Now, the Orchid Women's Health Initiative has been dedicated to transforming women's healthcare in our region for the last 3 years. Every year, the organization hosts the Orchid Gala to raise funds for the latest in technology, equipment, and facilities, directly helping to advance women's healthcare. To learn more about the upcoming fundraiser, we welcome Dr. Gail Darling, Chief of Surgery at Nova Scotia Health Central Zone, and Sherry Morgan, Co-Chair of the Orchid Gala. Good morning to you both.
Good morning.
Thank you for having us.
It is our pleasure to shine a spotlight on this wonderful initiative. And we're going to start with you, Sherry, because you spearheaded the Orchid Women's Health Initiative back 3 years ago. For those at home who aren't familiar, why did you start and what's your mission?
First, it started because our best friend, Deanne Reeve, passed away from a late diagnosis of cervical cancer. And then there was a lot of girls in our group. We were having issues, including myself, that we couldn't get looked at. You know, it was 2 and 3 years before we could get looked at. And then my daughter is one of 3 urogynecologists serving 1 million women of the Maritimes. So I know the struggles that she has. So it was a culmination of all of those things that we thought, we have to do something. We got to help government get something done for women's health.
And in 3 years, it's incredible what the Orchid Gala has been able to accomplish, the Orchid Women's Health Initiative. I will say that the work that they've been able to do, Dr. Darling, you can concur, is it has not only improved healthcare in our region, but it's inspired other regions to pull out their bootstraps and do better. What are we looking to raise, or what are you looking to raise money for this year?
Well, we're looking to raise money for surgical robotics. There are many women who have these cancers that can't have what we call minimally invasive surgery unless it's done by a robot, with the robot. And so if they can't have the robotic surgery, they end up with a big open incision, a week in the hospital as opposed to going home the next day, higher risk of complications. You know, so although the robot may be expensive, you know, we're recovering costs on the other side by saving women staying in the hospital for a week, saving the risk of complications. So it's really enabling technology for women.
So, Sherry, you're looking to raise $1 million at this year's Orchid Gala.
2 million.
2 million.
Yeah, well, once we realized, I mean, government helps us with everything that we're doing with the Orchid Gala. So, like, our first project was the Deanne Reeve Pelvic Health Suite over at the Dartmouth General Hospital, and they came in big time to help us get that done. And it's the same thing with the Da Vinci this year. This is a $10.8 million project, of which government's coming in with 7.
Okay.
You know, we can't thank them enough for what they're doing for women's health. Yeah, so it's $2 million that we're trying to raise, and it's looking pretty good.
And the gala is this Saturday night. How could people watching support in helping you reach your goal fundraising-wise?
Well, you can certainly go to the website, www.theorchidgala.com, and donate. And other than that, you know, it's leaders in the community, it's philanthropers, those type of people come in and buy your table or give whatever donation you want.
Sure.
And, yeah.
And we put the website on ours so people can either get tickets to the gala or make a donation themselves through that website, which is on ours. But Dr. Darling, I'll give we've got about just a few seconds left, but I know that this, even though we're talking about women's health, it is going to improve women's health, but when this Da Vinci robot gets in place, it's going to actually make healthcare better for everybody because it'll attract better talent and also improve wait times for everybody and improve surgical wait times for people. I'm correct in saying that, right?
Yeah, it's as I said, it's enabling technology not only for women's health, but for other subspecialties in surgery, colorectal surgery, thoracic surgery, liver surgery, and even ultimately cardiac surgery. So it really ups everybody's game and allows the surgeon to do a more precise operation, more controlled operation, you know, lower blood loss. It's really quite incredible.
Wonderful. Well, thank you both so much for coming in this morning and shining a spotlight on this initiative.
Thank you for having me.
Thank you.